Glaucoma surgery is necessary for my patient when drops or simple laser treatments such as SLT laser are unable to control the pressure at a sufficiently low level to stop their glaucoma from getting worse. We always start patients with glaucoma with either simple laser treatment such as SLT or drops treatment before recommending surgery. Overall, I think about 20% of my patients with glaucoma will require glaucoma surgery in their lifetime. We have to remember that glaucoma damage is a permanent damage to the eye. Therefore, we must recommend glaucoma surgery in a timely manner. For example, patients who are getting worse very rapidly may well need glaucoma surgery urgently, while patients who require glaucoma surgery, glaucoma surgery is progressing at a much slower rate, may not need an urgent surgical intervention. So it is important to establish whether patient have tried all sorts of simple drops treatment and simple laser treatment before recommending surgery. And the next one is to establish how quickly one needs to perform the glaucoma surgery, depending on the speed of the progression of their glaucoma. There are over 10 types of glaucoma surgery one can perform for our patient, but perhaps it's easier to categorize them into 3 groups. The first one being laser treatment, ranging from the simple SLT treatment, which can be performed in outpatient, to more invasive lasers such as micropulse laser or ECP laser, which need to be performed in theater. The second group is the relatively new category, which is called the mixed devices or minimally invasive glaucoma surgery. This type of surgery tends to be much quicker to perform and also carry much less intensive post-operative management, but they tend not to achieve the very low pressure post-operatively. And finally, the third one will be the more traditional glaucoma surgeries such as trabeculectomy, implant surgery, which could include Zen implant, Barbell implant, or armored valve implant. Obviously, all the glaucoma surgery carry advantages or certain disadvantages. It is important that we tailor different types of surgery for patients with different types of glaucoma and varying severity of their glaucoma. For example, patients with advanced glaucoma may need very, very low pressure post-operatively. Therefore, mixed devices may not be suitable for those groups of patients. So, in summary, I think it's important to choose the right type of surgery for our patient, because not all surgery are suitable for all our patients. The most common filtering glaucoma surgery in my practice still remains trabeculectomy. This is a surgery that has been around since the 1960s, but remains one of the best surgical techniques that we have. It is commonly used in conjunction with anti-scarring agents such as mitomycin C to improve this long-term success rate. Now, it is a fairly invasive surgery. It takes between 30 to 45 minutes to perform and generally will require a local anesthetic or general anesthetic in theater. It is very successful, but it is also quite invasive, therefore it carries higher risk of complication. But because it really does achieve very low pressure post-operatively, it is usually the recommended surgery of choice for patients with advanced glaucoma. Conversely, for what we call non-invasive glaucoma surgery, the most common one that I perform is probably either micropulse laser or ECP laser. Micropulse laser tend to be standalone procedure under local anesthetic, while ECP laser tend to be combined with cataract surgery. Both are equally effective. Obviously, a patient with early or moderate glaucoma will be a sort of my target patient for this type of procedure. Glaucoma surgeries are generally performed in the operating theatre apart from SLT laser, which can be performed in our patient's setting. The patient need to be lie down on operating theatre, and surgeons tend to use an operating microscope to perform the surgery. Surgery duration takes between 5 minutes for certain types of laser to an hour for more involved surgeries such as glaucoma tube surgery. Trabeculectomy would take around 30 to 45 minutes. So the choice of anesthetic will depend on the types of surgery involved. It can be a local anesthetic to sedation or even general anesthetic. I think the choice of anesthesia would depend on the patient's preference and the surgeon's preference to a certain extent. In general, if a surgery requires more than 45 minutes, it's probably safer and more comfortable for our patient to be done under general anesthetic. One final thing is post-operative care. I think aftercare is really pretty much a part of glaucoma surgery. Laser or mixed devices tend to be much less involved, so 1 to 2 visits post-operatively will be sufficient, while a tube surgery or trabeculectomy may well require 5 to 6 post-operative visits in the first 3 months. The success rate for glaucoma surgeries varies enormously. I think you could go from one extreme of a mixed surgery, which could or may only have 40% success rate, to trabeculectomy, which could have 80 to 90% success rate. However, one have to take into account that the risk of surgery is greater in trabeculectomy compared to mixed surgery, which is generally very low risk procedure and also much quicker to perform. So it's important to take both into account. But perhaps more importantly, when you look at success for glaucoma surgery, it all depends on what our patient needs. For example, a newer glaucoma surgery could have a success rate of 80%, but it may only have 20% chance of achieving very low pressure post-operatively. So for example, a patient of mine with advanced glaucoma may need pressure of 12. Now, if you look into those data of success rate, you might find that to achieve that level of pressure, the success rate for this new type of glaucoma could only be in 20%. Therefore, it would be, for me, it would be considered inappropriate. So it is important to understand that reported success rate varies enormously, and also the different level of pressure they achieve post-operatively vary enormously. It is important to find the right type of glaucoma surgery depending on the severity of patient's glaucoma and also expectations of how patient can or frequently attend post-operative visit. The recovery from surgery very much depends on the types of surgery performed. For example, iStent or Hydrus, which is considered the mixed devices, the recovery can be very quick. In fact, patient could go back to completely normal activity within 1 to 2 days. Likewise, for lasers such as micropulse or ECP laser, patient can go back to normal activity within a couple of days with no restrictions on exercises or driving even. However, more invasive surgeries such as trabeculectomy or tube surgery, those are surgery that require much longer recovery time. I would say a minimum of 2 weeks of work, and certainly no strenuous exercises for 2 to 3 weeks. Again, depends on how they're doing post-operatively. But I always urge my patient to prepare for at least 4 to 6 weeks of slightly blurry visions after tubes or trabeculectomy or tube surgery. It is important that we understand that those surgeries such as tubes or trabeculectomy are more involved, but also they can achieve much better long-term pressure control for patients with advanced glaucoma. So it's slightly more involved early on, but the benefit long-term is very pronounced.